actually have you put this underneath your stomach? Not underneath your hips, just to like here. Move it up a little bit. It was underneath your hip, I believe. So it should say like hamstring straight leg raise.
So this is the modified?
This is the 90-90 modified.
Oh, modified.
Is that what it is?
So the standard just says modified straight leg raise, that's what.
It probably doesn't say 90-90.
I don't know why.
It should be called 90-90.
Yeah.
So the next one is going to be Eli's test. I'll show you on this side, but again, when you're working, work on the side closest to you. This is just so that you guys can see a little bit better. This one is very easy. It's very kind of rudimentary, but it does have clinical applications. So that's why we show you guys this one. You're going to be stabilizing on that PSIS or even sacrum. You don't want to be pushing down, causing anterior pelvic tilt. You want to be preventing that anterior pelvic tilt when the Rec Fem is being tightened. So kind of on that sacrum, pushing it into, or maintaining that bit of posterior pelvic tilt. And then again with the pillow, you want the pillow more underneath the abdomen versus under the hips, because then you'll get hip flexion, which could give you a false positive since that Rec Fem would be shortened that way. Does that make sense? Mm-hmm. So stabilizing on that posterior pelvis, relax, exhale, breathe, and you're just flexing the knee until you feel some resistance, and I'm starting to feel resistance there. And then again, you can use a goni to measure the knee flexion. 90, or is it full knee flexion is normal?
I believe it's
Full knee flexion is normal. So he looks like he's about 95. And again, I would actually use the goni, same bony landmarks, lateral epicondyle, lateral malleolus up towards the greater trip.
This is MLT, right?
This is an MLT. So first, that first muscular resistance.
I think 90 is normal on that.
Okay.
I think going.
It says 90, so 90 degrees is normal. Again, this one is very rudimentary. This is just trying to get a basic idea. If I assessed this and felt like there's some tightness, I would still go into doing a full Thomas test. Okay. Questions about this one?
So Dr. Leva, she was like talking about like with Thomas tests, like if with his leg was kind of abducted. So you brought it
want to
back
make
to
sure,
neutral.
yeah.
So are you doing that with this as well?
Yeah, you're making sure he's not totally abducted, abducted. You want him in line with the hip joint. And same thing, I don't want to get external rotation. I don't want internal rotation. I just want neutral adduction, neutral IR, maintaining that posterior pelvic tilt, pushing until I get that first muscular resistance, and then I could take knee flexion measurement here.
Mm-hmm.
And 90 degrees.
90 is normal. I would guess you might still have some tightness, even though this is saying he's normal. There is clinical application, post-surgical. You'll definitely start feeling some of that pulling, some of that tightness earlier on, but I would still do, if you're ever in doubt, unless you're getting all the way here and you're not feeling any resistance at all, I would still do the Thomas test to get a more accurate reading. This is actually a good treatment position though, because you can control that tilt. It's comfortable for the patient. If they're comfortable laying on their stomach, it's just easy. And if they're getting a home exercise program, you can give them a strap where they can pull on their own foot and get their own stretch this way. Any other questions about those two? So the hamstring, 90-90, you want to get him, or your patient, you want to get your patient to 30 degrees or less of knee flexion. And then this is called Eli's test for the Rec Fem, 90 degrees or more of knee flexion. Any other questions about that? So we'll practice those until